Hello, I'm Nick the nurse. Today we're going to be talking about somatoform disorders and their relation to the mental health setting in nursing and on the NCLEX. What are somatoform disorders? Well, essentially, a somatoform disorder is a disorder, it's a mental health disorder or psychological or psychiatric disorder that manifests itself in a physical way. For example, a patient who might be having anxiety goes to the doctor not complaining of a psychosocial or mental health issue, but rather complains of a stomach ache, or they might complain of a backache. Whereas you might have another patient who is also, let's say that they experienced some type of traumatic event. Perhaps they saw someone who, God forbid, was raped or molested or something like that. And as a result of that, they went in to the physician's office and they complained of being blind, that they couldn't see anything. When in fact the blindness was actually caused by a mental health breakdown. So somatoform disorders, in other words, are diseases or mental health disorders, rather, that manifest themselves in a physical way. Now, the big problem here is that most of the time the patient is not going to realize that they have a mental health disorder, but rather think that their physical ailments have some type of physiological basis. Now, a lot of times in these patients, the physician or the nurse practitioner or physical assistant medical provider is going to run all kinds of diagnostic tests and all kinds of physiologic assessments, but they're not going to find anything physiologically wrong with the patient. So what ends up happening, I guess, as a result of ruling everything else out, the doctor will generally, maybe have them see a counselor or a psychologist to see if there's any mental health issues that might be causing these types of physical ailments, which are really caused mental health-wise. It's important that you try to get the patient who may be suffering from somatoform disorder to seek psychiatric or psychological care, and that should help their physiologic ailment. My name is Nick the nurse, and I want to thank you for watching this video. We'll see you next time.